And good afternoon, Aaron Smith. How are you doing this fine Monday?
Hello, Jason. I'm doing great. It's great to be back here on the PWBA podcast, and I think we're pretty excited about the special edition coming up today. Obviously, you can see the background. We're going pink here from the PWBA podcast today. It's Bowl for the Cure month, all of February, so we are excited to change things up a little bit here this week, and it's going to be a great opportunity for us to chat with some unbelievable individuals and get to learn along the way as well.
Yeah, I mean, there's so many great things that we do on the campus here, and this is absolutely one of them. I'm really excited to get to talk to these ladies here from Komen, to find out a little bit more about what they do and our partnership, and educate the audience a little bit more about how they can get involved. So that's going to be awesome. And then we're going to have a special treat towards the end of the show. We're going to have Chelsea Gilliam, who is a breast cancer survivor and also a PWBA bowler. One of the most inspirational people I've gotten the chance to meet over the course of my career, and I'm looking forward to catching up with her and hearing what she's up to.
Absolutely, and we'll be bringing in Sarah Rosales and Susan Brown in just a couple of seconds here. But you talked about the things we do on campus for Bowl for the Cure, and it's a partnership that's been going on since 2000, so more than 20 years now. We're going to learn a little bit more about that, but so many great opportunities to donate, be a part of the events that go around that take place across the country. So we'll mention again at the end of the show, but bowl.com/BFTC, Bowl for the Cure, a great resource to learn more. So many great things. And of course, even when you shop Bowl for the Cure, 25% of the proceeds go to Bowl for the Cure to help fight breast cancer. So you can find that at USBCBowlingStore.com. But so many great initiatives through this program. USBC and Susan G. Komen working together. So let's bring in our first guest, JT.
Let's do it. Yes.
All right. We'll start off with Susan Brown. There's Susan.
Hello. Good afternoon.
And
Good
here's
afternoon.
Sarah.
Hi.
Hello.
We are so thrilled to be here with you today.
It's awesome to have you guys.
What a big month.
Yes. I mean, great chance to promote awareness for Bowl for the Cure and for breast cancer awareness. We've got the pink behind us. You guys look like you're at home, but what have you guys been up to during the pandemic, and what are some of the initiatives that you're looking forward to working on this month?
Yeah. Well, it's been a big year, certainly for our country, and continues to be for the breast cancer community that we serve. So we remain, really focused on funding critical research. And I think, really doubling down on funding research on really the most aggressive forms of breast cancer, but also on research for communities that seem to be most affected with disparities in breast cancer outcomes. I think this year shined a really bright light on disparities in health outcomes with COVID-19, and those same disparities exist with breast cancer as well. So investing in research and focusing our work there, and also on our patient services. I think we saw more families, more men and women in treatment and caregivers needing the support of our critical patient services than ever before. So that includes our helpline and our treatment assistance program and our patient navigation services. So we've continued to stay a strong resource for the breast cancer community, and we're so grateful for this partnership and for the incredible support of the centers and the bowlers and the teams and the leagues that have really continued to stand with us and make the work we do so possible.
Yeah, that's awesome. And we're going to go into that a little bit more deeply in a second. But Sarah, I know you are a bowler yourself.
Yes.
I grew up in the Milwaukee area bowling. So tell us a little bit about your bowling background, and then we'll jump back into some of the work that you're doing.
Yeah. So bowling has been just such an important part of my entire family's life. I joined my first kind of Saturday morning bowling league when I was 4 years old. I had an older brother that bowled. And parents that bowled in the same couples league on Saturday night for 25 years with the same couples. So it's been just an incredible part of my family's kind of history in Milwaukee. Just such incredible memories of our time at Echo Bowl, just outside of Milwaukee. So it's been an incredible pastime, and one that I've been so thrilled to get to pass on to my own daughters. They're little, they're 4 and 2, but we've started with the bumper bowls here in Dallas, and looking forward to introducing them to the sport. I think it's just a great way to have fun and connect with friends and family.
That's very awesome, and looking forward to that. And we have a great resource here here in Arlington at the International Bowling Campus. We've got the ITRC for training and getting ready for these bowling games.
I think we need to be very clear about the skill level that I have.
But Sarah,
it's been a long time since I've bowled competitively, most certainly, but certainly something I enjoy for fun.
Never too late.
That's very true. Very true. Well, Sarah, your role with Susan G. Komen, you are the VP of Corporate Sponsorship. And as we kind of said at the top of the show, the partnership with USBC and Susan G. Komen has been going for more than 20 years. So can you just tell us a little bit about kind of the partnership that we have and just kind of everything that encompasses it?
Yeah, so more than 20 years of partnership, which is really incredible. And I think the fact that US Bowling and really, again, your centers and your bowlers and your teams have stood with us for 2 decades is incredible. I think that it demonstrates how this cause and this mission has resonated with the constituents that you serve. Breast cancer is a disease that affects so many of our lives. 1 in 8 women will be diagnosed in her lifetime. So many of us are touched by this disease. And I think this partnership and the way that your bowlers and centers have been able to engage has just been a really incredible kind of rally cry for people. So there's lots of different events around the country. Again, this is Bowl for the Cure month. So I saw on the Facebook page, there's lots of things happening, but really it is a year-round initiative. So there's opportunities for centers and bowlers to host events and raise funds anytime to support our mission.
Yeah, and I know that over the course of the partnership, over $13 million has been raised in some of these, in these events. What are those events look like, and how are the funds raised and how are they distributed?
Yeah, so the events look different. Some are small and some are big. Some are individual teams inviting their friends and families out for a special Bowl for the Cure event. Some are entire centers hosting kind of pink out nights, raising funds for Bowl for the Cure. And then all of those funds are sent to Susan G. Komen and invested in our critical research initiatives, as I shared, and again, our patient support services. So really our frontline work that we do to support patients and caregivers.
Very excellent. And, talking about the relationship, one of the big events we look forward to every year, obviously with the pandemic, we haven't been able to have in 2021 on site, but at the USBC annual convention, there's always a great moment where just everybody comes together to celebrate the year for Bowl for the Cure and everything that's come together. And I know I've only been to one convention myself, but I've seen it in person, and it was just one of those moments where you get chills experiencing it. You see all the lights go pink, everyone's cheering, going crazy for just the year that Bowl for the Cure created. So talk a little bit about that as well. Obviously, as we said, we haven't had the opportunity to do it in 20 or 21, but it's something special and a great moment.
Yeah, such a powerful moment. I think whenever, again, you see organizations rally behind a cause, I think that opportunity to come together and build community and celebrate what a group has accomplished and what US Bowling has accomplished over the years is just so incredible. And together you've helped celebrate survivors and those living with metastatic breast cancer, those currently in treatment, and you've really been able to authentically tell stories of how your funds raised are driving impact for individuals in your communities. And I think that's what's so incredible. And I'll be really excited to be at the conference, hopefully next time around.
Yeah, yeah, for sure. I mean, it is a great moment. But what are before Susan? Hi, you're still yeah.
Hi.
We're going to bring you into the conversation in a second here, but Sarah, one more thing. What are some of your favorite events over the years that have taken place, and maybe one or two good little stories about some of the stuff that we've done together with Bull for the Cure?
Well, I had the opportunity to see the video of the 4 women that you invited to Dallas. I think it was 2015. I think we're going to meet Chelsea in just a little bit. But the opportunity to, again, introduce your community to women who are currently in treatment or survivors and tell their stories. What an incredible experience for those 4 women. I think an experience that changed their lives forever. And just a great way, again, to celebrate our incredible partnership.
And how can people get more involved, and where can they find, more information about how to get more involved?
So there's a Facebook page, Bull for the Cure, and then BFTC. Bull.com BFTC. Did I get that right?
That's it. Yep.
Perfect.
Awesome. Well, let's move on and talk to Susan a little bit. Susan, you're the expert when it comes to understanding this disease and what impacts it has on folks. First of all, what is? I mean, I think it seems pretty obvious, but what is breast cancer, and why is it such a nefarious thing that we're dealing with in our life?
Well, breast cancer is a disease that obviously starts in the breast, where the cells in the breast tissue go crazy. They continue to grow and grow and grow. They don't die like they're supposed to, and they form tumors. And cancerous tumor that starts in the breast really has the ability to spread within the breast, and more importantly, for some of those cells to break off and travel to other parts of the body where they grow again. And Sarah mentioned metastatic breast cancer, and that's what this is. When breast cancer spreads to another organ and starts to grow again. And metastatic breast cancer is so important because that's really what causes the deaths associated with breast cancer. It's a big problem because it's the most common cancer among women in the United States, and as a matter of fact, in the world. And so chances are someone that's been impacted by breast cancer, and if you don't know someone that's been impacted yet, chances are you will at some point. So it's something that everyone needs to know about and to care about, really.
Yeah. I know cancer can sometimes be kind of a random thing. Sometimes people will get it just out of no fault of their own. But what are some of the more common things that are actually related to the causes of breast cancer?
So we honestly don't know exactly what causes breast cancer to develop in one person and not another person at a certain point in time. We know that all the cancers start as a result of a genetic mutation. We don't know what causes those genetic mutations in most cases. So that those are things that could happen during the course of a person's lifetime related to lifestyle or exposure to some environmental toxin that we don't even recognize yet. About 5 to 10% of breast cancers are associated with an inherited gene mutation. So this mutation that a child inherits from either a mom or a dad. And so later when we talk about the importance of family history, that really illustrates that a dad's family's history is important to an individual, just like a mom's family history related to breast cancer.
Gotcha. Are there certain types of people that are more at risk than others?
Well, the take-home message is that everyone's at risk, so I'm going to start with that. But then I will say that breast cancer, the risk typically increases as people get older. The 2 most common risk factors for developing breast cancer are being born female and getting older. And we can't do anything about either of those things. And so that's why we come back to the point that all people are at risk. Everyone is at risk for developing breast cancer.
Yeah. Are there any other causes like smoking? I know smoking is associated a lot with lung cancer, or diet. Are there any of those kinds of things that you have to watch out for that can actually decrease if you avoid those things?
So other things that increase the risk of developing breast cancer are being overweight or obese in adulthood. Lack of physical activity is associated with an increased risk. Using alcohol intake, using postmenopausal hormones are also associated with an increased risk in breast cancer. Some of those things we can do something about, but other things we can't do anything about. So what we can do is be aware that breast cancer is a possibility. We're all at risk for developing the disease, and then being very aware of our bodies, being conscious of changes that we might see in our breast, talking to our families about our family's history. Family history can increase a person's risk of developing breast cancer. But on the flip side, not having a history of breast cancer doesn't mean that an individual is safe. As a matter of fact, most people, 87% of cases of breast cancer occur in women who have no close family relative with a history of breast cancer. Again, back to that message, everyone is at risk.
Yeah, that's interesting. And I know Chelsea, who we have coming up on the show, she was somebody who got it at a very young age and is very much an advocate of early detection. What are some of the things people can do to detect it as soon as possible?
Well, knowing your risk is important for one thing. So knowing your family's history is information that you can gather at any age, and then take that information to your healthcare provider, and then talk about what screening tests are going to be appropriate for you based on your age, and then also your risk. Screening mammography is sort of the gold standard for finding breast cancer early. I think everyone's heard about mammograms. Having a physical exam, a clinical breast exam is also important, because while mammograms are accurate, no screening test is 100%. So a clinical exam and a mammogram together are the most, those things together are more accurate. And then for people who are at very high risk for breast cancer, so being a member of one of those families I mentioned before where there's a known genetic mutation is an indication of being at very high risk. And then breast MRI might be added to a screening regimen for those people.
Gotcha. So, when someone actually is diagnosed, what is the treatment that they typically would undergo? And I assume it's different, based on the stage that you're diagnosed with, correct?
That's right. Treatment is personalized, individualized, based on the characteristics of the tumor. You get that information from a pathology report after a biopsy. And then treatment almost always includes surgery and then some other form of treatment, usually radiation therapy or a drug therapy that might include hormone therapy or chemotherapy or HER2 targeted therapy. Again, and those decisions are based on the characteristics of that individual's tumor. And so it's a medical decision, but it's also a personal decision. So patients, along with their providers, discuss the options, and then together in partnership make the decisions about what treatment is going to be best for that individual.
Gotcha.
Susan, obviously there's many times with breast cancer, it's mostly associated with on the female side, but why is it important for our male viewers watching to learn more about breast cancer?
Well, breast cancer can occur in men, and sometimes men are very surprised to hear that. And sometimes there's a delay in diagnosis because breast cancer wasn't even on their radar. But more likely, they'll be placed in a role as a co-survivor. So as someone who knows a woman who in their life who has been impacted by breast cancer. It might be a partner, a sister, a mom, a colleague. And so really just being aware of that breast cancer can be, that when someone in their life is going through breast cancer, it can be very important. They can play a very supportive role. Mostly they can just be there, be available, communicate that they care and that they're thinking about them. They can take on more practical roles, depending on the relationship, the nature of the relationship. They can accompany family members to a doctor's appointment. They can handle the insurance. They can help with things at home, childcare, meals, laundry, all of those kinds of things. So it just basically depends on the relationship between that man and then that woman that's being impacted by breast cancer.
Yeah, and if you're a man watching the show, don't wait till your wife gets breast cancer to help with the laundry and some of that other stuff, right? Should be doing that already.
That's just practical advice,
Exactly.
on a daily basis,
Exactly.
right?
Yes, exactly. So, what you talked a little bit about what men can do. What are some of the things specifically, when your partner is diagnosed that you can do, from, like, I think a lot, you mentioned a lot of the things, generally, but specifically, what are some of the things that men can do when their partner comes down with a diagnosis of breast cancer? And what are some of the stories that you've seen of some of the men out there helping their spouses or partners get through this?
Well, in some parts of the world, and actually even here, there is a stigma associated with breast cancer. And in the Middle East, women are fearful that their husbands will take another wife if they're diagnosed with breast cancer. And of course, that's not the concern here in our country. But in our country, there is concern by many women that their husbands or their partners will leave them if they're diagnosed with breast cancer. And so I think that men can play a huge role really in the community, as well as in their families, by showing support for the women in their lives who are impacted by breast cancer. Changing that changing that attitude toward breast cancer among the men, and then also among the women.
Yeah, that's sad to hear things like that, but I mean, yeah, it's I don't know what else to say about that, really. I mean, I can't imagine, if my wife were to be diagnosed with breast cancer, not wanting to support her to the fullest extent, but that's just me.
On the other hand, I worked with a man at one point, and his wife was diagnosed with breast cancer, and he did the legwork. He went out and learned what he could about breast cancer, because when you Google breast cancer, which we don't recommend, we recommend you go to komen.org if you want to learn about breast cancer. But he went out and he did the research, and he came back and distilled it and came back to her, and then accompanied her to her doctor's appointments and was there as a listening ear, and then also just to support the decision that ultimately was hers to make. So it runs the gamut, and we hear many more stories about those supportive men than we do the other men, for sure.
Yeah, that's good to hear. So what is your message to people that just want to educate themselves a little bit more about how to be more aware of this disease, how to help other people that maybe are suffering from it, and also how to just ward it off in their own lives?
So I think there are a couple of things. One, everyone's at risk for breast cancer. One of the things everyone can do is to talk to their families about their family's medical history, because that can impact an individual's own history. Take that information, go to their doctors, have a conversation about their personal risk and about the screening tests that are right for them. It's important for women and men to be familiar with their bodies, so that if they notice a physical change, they recognize it as a change and they seek that care from their healthcare providers. And then to make some healthy lifestyle choices to control their weight, maintain an overall healthy diet, limit alcohol intake, avoid the use of postmenopausal hormones, breastfeed if you can. And in general, understand that breast cancer is a problem. Yes, it's a problem, but mortality has been reduced more than 40% since 1989. We've made such strides, and the options women have for treatment and men have for treatment today are as a result of all of the investment that's been made in research for in the past years, and the importance of people agreeing to participate in clinical trials so that we could bring that research from the laboratory into the clinic. And all of us today will benefit from that, and those that come after us will also benefit from our willingness to invest in the research and to participate in clinical trials when we have those opportunities.
Gotcha. And Sarah mentioned this, but what can people do to help support the cause?
So look around in your community, look to those Bowling for the Cure events, participate. There are other events. There are common More Than Pink walks, there are breast cancer 3 days. There are people in communities that are doing DIY activities that all draw attention to the issue of breast cancer and raise funds to support the activities that Sarah already described. And we just are, we want to be a big family, and that we want to be a family that's inclusive of people that want to support in all sorts of ways.
Gotcha. Well, we've got a survivor waiting in the green room. Would you like to meet one of our most inspirational people, one of the most inspirational people I've ever met?
We'd love to. As a matter of fact, I think I was at Komen headquarters when Chelsea came and visited a few years ago. And Sarah mentioned, and you mentioned how it impacted the bowlers that came to headquarters, but I'll just have to say, on behalf of all of us that were there, it was very inspirational for all of us to see these incredible women and to hear the stories they had to share. So I think we gained as much or more than they did.
Well, let's bring in Chelsea. We really appreciate all the information, Sarah and Susan, about Bowl for the Cure and what you guys are doing. It's a huge thing that you're doing for the world, and I'm sure it makes you feel good every day when you get up in the morning and know that you're helping, make the world a better place. But this young lady, she's always, every time I've run into her, she's made the world a better place for me. So let's say hi to her. Hello, Chelsea.
Hey,
How are you?
Hi, I'm good. How are you guys?
Doing great. Doing fantastic.
We are so happy to see you.
It's awesome to see everybody.
So you got to go to the headquarters a few years back, Chelsea. You were one of the winners of the Fabulous Four contest that we ran. What was that experience like for you?
It was so awesome. Not only meeting the other three women, them alone, it felt like we had known each other forever by the time our week was over. So that was great. And we still talk to each other today. But just getting to go to the headquarters was cool because we all hear about Komen and everything. And so it was nice to see behind the scenes, meet some of the people that work hard and everything that goes into all of the stuff we see out in the world.
Yeah, no, I mean, it was such a cool experience. I got to film it, which, I got to go to Reno with you guys and do the women's championships experience, and then, put a little video together on the whole experience. But what was that experience just, like for you?
It was crazy, but it was so much fun. I had always wanted to bowl in Reno. And so the fact that I got to do it supporting this cause was even better.
Yeah. And you are a heck of a good bowler in your own right. So was that, I know, you were definitely the best bowler of the group. Did that put a little pressure on you to perform?
Yes. Yes. I remember they stopped me when we walked in. They stopped me and were asking me questions, and that caught me off guard. And then we all four threw out the first shot, and so I was definitely nervous on that one, but we made it through.
Well, Susan and Sarah, before we move on to the rest of our conversation with Chelsea, any kind of final thoughts that you guys want to give to the audience at home before we let you guys go?
Well, first, Chelsea, thanks for joining the conversation today. We're so inspired by you and so proud of you and so grateful just to have you part of the Komen community. So we are all continuing to root for you, most certainly. And I think really to the entire bowling community, thank you. Thanks for continuing to support Komen and continuing to allow us to do the work we all know is so important.
And I would just say thank you to Chelsea for sharing your story, because you just being here and sharing your story is so inspirational to us and to everyone else who hears it. So thank you so much for being courageous and being willing to inspire others the way that you do.
Thank
Well,
you.
Susan and Sarah, we really appreciate your guys' time this afternoon. And one last, where can people go to find more about Bowl for the Cure and Komen?
You can go to komen.org for more information on breast cancer and your breast health. And for more information on Bowl for the Cure, go to bowl.com/BFTC.
Awesome. Well, thank you guys again so much for joining us today. And thank you for all you're doing.
Thank you so much
for having us.
So Chelsea, what have you been up to lately? Let's just start there.
Not as much as I normally am, which is weird because I have a lot of downtime and I don't know what to do with it. So
yeah, join the club.
Some recruiting. Our school, we actually opted out of competition for the whole year, so we don't have a tournament schedule or anything, but hopefully the girls are supposed to be back on campus next week, and so I'm keeping my fingers crossed that we'll at least get to practice some this year.
Yeah. Tell the folks watching what are some of your background, your bowling history, and then what you're doing now, your competitive stuff, and give the folks a little bit of a background on that.
Yeah, so I've been bowling since I was 5. Grew up in bowling centers. I was that little kid on Friday nights running around while their parents were bowling league.
Me too.
And then bowled in high school. I went off to college. I bowled at the University of Pikeville for 4 years. And then after that, I started coaching, got a graduate assistant position at Union College, became the head coach there, spent 3 years there. Then I got to the wonderful opportunity to start the program at Youngstown State University, which was amazing because it's not every day you get to start a Division I program. So I had a great group of girls there, spent 3 years there, and now I'm down in warm, sunny Florida coaching at Bethune-Cookman University.
Nice.
Yeah.
Well, yeah, I was in Wichita this weekend. It was 13, so I was very jealous of Florida weather for sure.
We're finally warming back up. We're in the 70s again. It was cold for a while. We were 40, so that's freezing.
Yeah,
down
I
here.
know. I feel so bad for you. Actually, in Texas, it's not too bad. But Wichita was not warm.
Oh, I bet.
Yeah. So let's talk about your story with breast cancer. When were you diagnosed? When did you find out? And what was kind of your reaction?
So I was originally diagnosed in 2013. I had been having some unusual symptoms, and so I ended up going to the emergency room one night, and they did some tests and everything like that, and they said, okay, tomorrow you need to go and have an ultrasound done, and don't let them tell you no. So I was like, okay, that kind of threw me off a little bit. But then, so I went, we did the ultrasound. They came back and they're like, well, there's something. So then we did a biopsy. And I always say they told me 3 times before I even got to the doctor's office. I knew. They called me that morning and they were like, oh, we just want to make sure that somebody comes with you to your appointment. So I was like, oh, well, there's, strike one. That don't usually happen.
Yeah.
And then once we got there, we were in the waiting room, my mom and I, she was here, and they kept taking people back that had came after us. And a nurse finally came out and she said, well, the doctor just wants to make sure that she has plenty of time to talk to you. And I was like, okay, well, there's strike 2.
Yeah.
And then when they finally called us back, instead of taking us into an exam room, they took us into the doctor's office. And so I was like, well, there's strike 3. So I had been preparing myself like all morning to hear what they were about to tell me because they pretty much had already told me. So it was crazy because I was only 23. So that's the youngest anyone like they had ever seen. They said that they were going to send me to doctors in Lexington because they didn't know. So even those doctors said I was the youngest patient they had ever had. So it was kind of crazy, but we were just like, okay, here's what we're going to do. And that's what we did. So
Yeah. Yeah. I mean, I'm sure it's kind of everybody's worst nightmare, right? Like learning that you have cancer. How did you deal with that? Like I know a lot of people also don't want to find out because they're afraid of that moment of realization that they have it. So what would be your advice to people that, are afraid to, kind of find out?
my biggest thing ever since the beginning, and people always comment on how open I am about my story and everything. Because if, we're friends on Facebook, I always post updates about what's going on. And my biggest thing is because I was so young, it's so important to me that if another young woman or man, reads something that I post and they notice something early and it saves their life, then that's why I am so open about everything.
Yeah. Yeah. No, that's a great message. So, tell us the story of, your fight and how, what was that like, and what did you have to go through?
So the first time we did surgery, and it wasn't, I mean, it was bad, but it wasn't as bad as I expected it to be. But I also had my teams, and our athletic staff at Union were super supportive, and my athletes kept me busy. And I've always tried to stay busy doing something to keep my mind on other things. And then the second time, kind of the same situation. That is a little crazier story. Once we found out that it had came back, I had been having some hip pain for a few months, and we thought I had pulled a muscle. And when they told me that it came back, I brought it up to the surgeon. I'm like, hey, I've been having this pain. It just won't go away. And she was like, well, maybe it's just, because you're a jock, your sports and you're always so active and stuff. I'm like, I don't know. So they ended up ordering a bone scan. And so I was actually in Illinois for my best friend's wedding. And then I was going to fly to Reno for nationals from there. So they wanted the bone scan. So I drove back to Ohio, did the test, drove back, flew out to Reno, bowled 9 games. I was on pain meds and anti-inflammatories because it was hurting. And then 4 days later, I found out that I had actually just bowled on a fractured femur.
Wow. You're like Tiger Woods.
Yeah. And they were like, yeah, your hip could break at any moment.
Wow.
So we're going to do surgery right away. And then during the surgery, they tested the tissue and it came back positive that it was the same breast cancer that had caused the issues in my leg. So that's how we found out that I was now stage 4. So
yeah. And then what treatment happened after that?
we did the surgery. So now I have an awesome titanium rod in my leg.
Nice.
But it's kind of boring because it doesn't set off metal detectors. So I'm like,
if you want titanium in your body, you want all the benefits of it, right?
I'm like, at least if I have to have it, it could, set off a metal detector every once in a while. But then we did radiation on my leg. And then after that, I was on an oral chemo, hormone therapy daily. And then actually back in August, I had a surgery. And so I used to be HER2 negative. And then in August, my surgeon just happened to send a sample to pathology, and they found that I'm now HER2 positive, which completely changed my treatment plan and started with chemo, which is why you see me in my awesome hats. If you see me around, you see me in a hat right now. So
yes.
But I just finished that up 2 weeks ago, and my doctors are happy with how my scans looked. So now we'll continue maintenance therapy and medication. So
Yeah, I mean, you're obviously, we are all rooting for you. And the thing that's so awesome about you is, you're on the show here today, you're smiling, it's just a normal part of your life. I mean, you remind me of Rocky. Rocky gets knocked down by Apollo Creed and he just keeps getting back up. And not only does he get back up, but he punches back. And it feels like that's what you do.
yeah, I always tell people, I'm going to live my life the way I want to live it. And I'm going to do the things that I want to do, like bowling the tour and coaching and all of this stuff, traveling. And cancer's just going to have to come along for the ride because we got things to do and we're not going to sit around and not do it. So
yeah,
Awesome.
that's awesome. That's awesome. So what else is going on? You talked about, all the other things that you got going on in your life. What are you working on? Are you looking to try to get back out and bowl against the ladies on the PWBA? I know you're working with your, probably pretty hard to build a new college program.
yeah.
Yeah.
Recruiting, trying to build the program back up. It's difficult right now. If the NCAA could stop extending our dead period, that would be great because down here in Florida, we've had so many youth tournaments going on and I'm not allowed to go watch them. So it's very difficult, but doing that, excited to get the girls back on campus. And I am definitely looking forward to being back on the lanes, and I want to get back out on the tour. As long as my goal now is to build some strength back up, and start practicing again and get out there soon. So
That's awesome. So you talked a little bit about, being a coach. How do you weave in your own personal experience into, the message that you deliver to your athletes? Do you even mention it? I mean, I'm sure that's something they know about and are aware of. And how do you use that to motivate them?
oh yeah, they are definitely aware. That's something that every year, especially with the new freshmen, I tell them right away. Our first team meeting, I'm like, hey, this is what's going on. Some days I may seem off because I have my bad days for sure. And I just tell them, it's probably not you. It's probably just me having a day. But they're fully aware. I update them all the time just because I want that transparency and I want them to feel comfortable coming to talk to me or asking questions because I'm with young females, 18 to 22, and I was 23. So I want them, if they have a question or, even if something's going on and they start noticing something, I want them to feel like they can come and talk to me and have someone that's going to help them get whatever they need.
Yeah. Yeah. And I know, just by getting up every day and doing what you do, you're inspiring people. But what are some of the other things that, you try to tell people about how to get more involved in the cause?
I try to push, the Bowl for the Cure events. I have a lot of friends that host tournaments and they usually do a Bowl for the Cure event. So I try and share that information. I also share facts and stuff like that about Komen. But another big one for me is the Metaviver organization. It's for metastatic breast cancer survivors, and they are really big on doing research and grants and stuff for metastatic cancer specifically, which I love Komen, and they do a lot for breast cancer as a whole, but stage 4 doesn't always necessarily get as much research, I think, as we need, because I feel like if we can cure stage 4, we'll be able to cure all cancer.
Yeah.
So that's a big one. That's one that I, for donations and stuff, whenever it comes up, that's one that's really big for me. So
Gotcha.
Chelsea.
Well, go ahead, Aaron. Sorry.
No problem. I just wanted to hear a little bit about the, through the course of your journey, just the support from the bowling community. I know we did an article on PWBA.com a couple of years ago, and you talked about the support of, the athletes that you coach, the programs that you've been a part of. But just talk about the bowling community in general and how they've been able to support you throughout this fight?
It's been amazing because I know, with bowling, we meet people from all over the country and I mean, all over the world. And that was one thing about the tour. I got to meet a lot more women. And so now I have friends from everywhere and I'll get messages, randomly saying that, asking how I'm doing, or they're supporting me and stuff like that. And so it's nice because I have my family and I have my athletes, but I also have an even wider, bigger group of people all over supporting me. And that helps me just push a little further every day.
Yeah. So, I know, it's interesting. We talked about getting up every day and punching back. Do you have, some long-term goals that you've set for yourself, or is it just kind of like hey, let's get up every day and every day we just, do our best? And, what are you looking forward to in the future?
I was, that's a tough question because, you want to set goals and like, I want to bowl the tour again and I want to, build a successive program and, have a family and everything, but it's hard also because the future is it's unclear and who knows what's going to happen tomorrow. Like when my cancer type changed, I think that only happens in like 15% of women, that change happens. So you set goals because that's what keeps me, pushing forward and stuff, but you don't want to, set hopes too high because things could change tomorrow. So
yeah. And is it something, that you've, like, for example, before you were diagnosed, did your outlook change once you were diagnosed, or have you always been, this kind of a person?
I think I've always been this kind of person. But it probably more of, okay, I want to do this, I'm going to do it type thing. After I was diagnosed, I was like, I'm not going to let this keep me from doing the things I want to do. And I'm still going to enjoy life. And I think I've probably maybe become a little more adventurous since. I used to just be a homebody and I would want to, just do my stuff and then relax at home. And now I'm like, okay, well, I want to travel and I want to go see these things. So that's probably been a benefit to this situation, if there is one. So
yeah, no, exactly. Do you actually, preach that to others now? Just say, hey, why are you being a homebody? Why are you not trying? Why are you not doing? Look at me.
Yes. Yeah. I'm like, well, it's hard right now because, we all have been sitting at home.
Right.
And it's probably been the hardest for me, is being home, not having stuff to do is worn on me the most. But when we're able to do things, I'm like, someone would say, oh, I've always wanted to go here. I'm like, well, then go,
Right.
Like if you have the time and you have the ability, do it, because you don't know when you're not going to be able to do it. So yeah, I definitely tell people, if you want to go on a trip, take the trip. If there's a new job opportunity, take the job opportunity, just go and just do it.
Yeah. Well, Chelsea, one of the things that we have traditionally done on this podcast is, and since we've all been homebodies lately, is we ask for your Chelsea Gilliam binge watch recommendations. We want to know what TV you're watching. We want to know what movies you're watching. What are the Chelsea Gilliam must watches?
Let's see. I've binge watched so much stuff.
Yeah.
Bridgerton, I know that's a big one.
Yeah.
Around, and then I also recently finished Ray Donovan, which I think the show ended last January, but I binged watched that. I thought it was pretty good.
Yeah.
Let's see what else. Sweet Magnolias, I think, is a little series. It's super cute. So if you like something a little more, I don't know how to describe it, but it's cute.
Sure. What is your favorite movie of all time?
The Dark Knight.
Oh, that's
Heath Ledger as the Joker. He was probably my favorite Joker And then the newest one I thought was really, really good too. It was definitely had a darker twist to it, but
Yeah.
I'm a huge Batman fan, so
Are
The
you
Dark
looking
Knight
forward to
is-
the Rob Pattinson one?
I'm optimistically cautious about how he is going to portray Batman.
Yeah.
So
Yeah. Are you a Rob Pattinson? Are you a Twilight fan?
I watched them. I wasn't as big into it as a lot of my friends were, but I did watch the movies.
Gotcha.
And that is why I'm optimistically cautious about how he's going to play Batman.
He was in Harry Potter too.
He was. I
Yeah.
said he died in Harry Potter and then
Yeah.
he became Edward Cullen. That's how it
Yeah.
happened.
Yeah, exactly. It's like a wormhole.
Yeah.
Awesome. Well, what is kind of your final message to, the folks watching at home about this whole terrible disease and, how you've dealt with it and how you've, survived and moved through it and been an inspiration to everybody?
Oh, thank you. I would say be positive as much as possible. I know it's easier said than done, but I feel like it's helped me get through some tough news and tough days, just being positive that, good days are going to come. And also be aware of what's going on with your body. Pay attention. And if you notice something, I know it can be scary, but go get it checked out, because if it is something, it's a million times better to find it early and take care of it than to wait and have it be a worse situation in the long run.
Yeah, that's a great message.
Mm-hmm.
Thank you so much for everything you're doing. It's really great to get to see you and catch up with you.
Yeah, thank you guys so much for having me. I was super excited when you asked. So
Yeah, no, it's
awesome.
been awesome. And good luck with everything. If there's anything we can do for you to help, let us know.
I will, and hopefully I'll see you guys on the lanes.
Yes.
Sooner rather than later.
Yes.
That's what we like to hear.
Yeah, exactly. And also, if you want to come and do some Bull TV commentary, we'd love to have you too.
Awesome. Yeah, definitely. My competitive side is itching, so we'll get back out there, and I would love to join you guys for sure.
Awesome. Well, thanks so much. Have a great rest of your day, and we'll talk to you soon.
Thanks, you too. Bye.
Thanks, Chelsea.
Great show, Aaron. There's just a lot of really great stuff. Chelsea, obviously a huge inspiration to people. I wish more people knew her story. That's one of the reasons why we wanted to have her on today, so people would, know more about her, and more people need to live their lives like Chelsea Gilliam.
I agree. And, we were, talking movies, talking about Twilight, and I think we're all team Chelsea here. So let's get that out there. No, just a great inspiration. We've gotten to work with her multiple times over the years. We talked about the Fabulous Four in 2015, the PWBA tour, and her work collegiately. Just such a great individual in the bowling community. Outside of her fight, her struggle, and everything she's gone through, just a great ambassador for bowling in the first part. But yes, her story is one that we've gotten to share a couple times, and it's we're always rooting for Chelsea. We're always pulling for Chelsea, and it was great to hear her story once again and catch up and just get that positive energy that she brings as well. That's very awesome. Obviously, it could be a different outlook for sure, but her positivity, she's joking around, having a great time. That brings a lot to every conversation you have with her.
Absolutely. So anyway, we're going to have her on Bull TV. She's going to be our new guest commentator. So you look forward to that. And then there's no doubt in my mind she'll be back out on the lanes, kicking some butt. Look out, Gillian Martin. Chelsea's coming for you.
There we go. There we go.
It was also nice to have Sarah Rosales and Susan Brown on the show. So if you're interested in more information about Bowl for the Cure or Komen, where can they find that, Aaron?
The place to go, bowlforthecure or bowl.com. See, Sarah had that too, but the main spot for us is bowl.com/bowlforthecure. BFTC for short. So there's a few different ways to get through it on our website. Of course, as mentioned, we also have multiple social media aspects to follow Bowl for the Cure as well. So Facebook, Instagram, Twitter, all the normal spots, and then Komen.org for all the great information courtesy of Susan G. Komen. Throughout the course of this journey, we talked to Sarah, we talked to Susan, but we got to give a shout out as well to Taylor Jacobs on the Susan G. Komen side, and then Reagan Beverly on the USBC Bowl for the Cure side for all the hard work they do as well to make all this possible. So I know, I work with Reagan on quite a few of the newsletters and stuff like that. So there's so much great information available on that site. So be sure to check out both sites. And just thank you to everyone involved in trying to find a cure and fight this. And we're going pink, folks.
That's right. That's right. Well, Aaron, we got a lot of more great content coming up on Bowl TV and our social media channels the rest of the week. I'm going to have Lou Marquez on Bowling Explained on Wednesday. What have you guys got cooking up in the OC world?
Well, we have a show coming up on Thursday. It was originally supposed to be Chris Castle from Australia. I think Matt said we might have to find a late replacement, though. So we potentially looking on securing that later in the week, but we'll have someone on Thursday. So we will be here and available. That'll be 2 p.m. Eastern for both shows. So of course, check that out. And then coming up a little bit later, the following week, the Hoosier Classic, our next live event on February 20th and 21st. Looking forward to that and getting back into the collegiate realm. Yeah,
awesome. And if you happen to miss the Mid-States Championships this weekend, we covered that on Bowl TV. All those events are in the archive as well if you want to go back and check that out. But thanks everybody for joining us today. We really appreciate it. Aaron, who would you like to thank before we close it out for today?
Everybody. No, once again, just first and foremost, Chelsea Gilliam for joining us, sharing her story once again. Such an inspiration. We have from the Susan G. Komen side, Sarah Rosales, Susan Brown, and Taylor Jacobs here from the campus. Reagan Beverly. For Jason Thomas, I'm Aaron Smith. Thank you again for watching the PWBA podcast. And remember, folks, on Bowl TV, bowling lives here. Have a great week, folks.